Turning now to the coronavirus pandemic, kids under 5 are now eligible to get COVID vaccines. They'll be available in the mid-state as early as Tuesday.
Daniel Hamburg talked with a doctor and parents. He joins us with more. Daniel.
Janelle and Taylor, there are a number of parents who are excited to get their toddlers vaccinated, but there's still some hesitation for others.
Climb up.
Jessica Vogelsong has 3 kids under the age of 5.
You want to climb through the tube?
And she's excited for the chance to protect them all against COVID.
We are big believers of vaccines, and this one was no different.
The youngest kids can now either get a 3-dose series of the Pfizer vaccine or 2 doses of Moderna.
The data shows that these are moderately effective vaccines. We don't see those 90% effectiveness rates that we saw in the early days of clinical trials, and you wouldn't expect to see that because these trials are done at a time when Omicron is the major circulating variant, and all of our vaccines have decreased efficacy against infection with Omicron.
Good job. Where's Annie? Is she coming down?
Ryan Mordoff, visiting from California, plans on getting 4-year-old Annie vaccinated.
We've had a crazy uptick at their school recently. Like, it's been worse than it's ever been. So we figured, like, we're just doing everything we can just to, keep them safe.
While some plan to line up immediately, infectious disease doctor Amesh Adalja expects the uptake to be limited.
I do think that probably about 20%, 25% of parents of children under the age of 5 will be lining up to get this vaccine, especially if their child is high risk, maybe has asthma, immunocompromised. But if you look at the 5 to 11 age group, only about 30% of those children are fully vaccinated.
Dean Pletcher's twins have been vaccinated against many other diseases, but is iffy on the COVID shots.
The 2 things that I'm iffy about are the fact that it's at least Pfizer's and Moderna's are mRNA vaccines, so they work differently. The other thing is they haven't been out long enough, like the other vaccines they get, to really know a long-term effect on kids this young.
Adalja insists they are safe vaccines that will decrease the rate of severe disease, hospitalization, and death.
The more people that are vaccinated, the more manageable COVID-19 becomes as an infectious disease. And if you look at children under the age of 5, about 45,000 of them have been hospitalized and about 400 have died. And we vaccinate for things that are much less serious all the time, like chickenpox, like rotavirus.
And the State Department of Health says that pharmacists are only allowed to provide vaccines to children 3 years and older, so parents should contact their pediatrician or family doctor if they want to schedule a vaccine appointment for children younger than 3. In the studio, Daniel Hamburg, ABC 27 News.